Okay,
Should I record?
it's recording.
Got it.
Okay. Do you want me to start?
Yeah, let's go ahead and get started.
Okay.
So
We'll
just to preface our situation that we've knocked on the door and we've given our patients a hand, right? And
Yes.
so we've done our hand hygiene, we've washed our hands, we've
Yes.
identified the patient's date of birth and then their name and any allergies, and we've taken note of that, right?
Yes.
Okay, we've both done that, and then now we're going to go ahead and start on our health history questionnaire after we've done our inspection, right? And we've assessed the situation of the person and identified their age, all that good stuff that we're supposed to do, right?
You're doing so good, Matthew.
We're both doing well here. Okay, let's go ahead and get started.
Okay. So, Mr. Jones, it says that you are 37. Is that correct?
That is correct.
And do you happen to know the ages of your mother and your father?
My mother and father are currently 65. Let's see, my mom was 65, and my dad is 70.
Okay. Do you have any siblings?
I have no siblings.
And then what about your maternal grandmother? Do you happen to know her age?
She would probably, she's no longer alive right now, but she would probably be 95.
And what about your paternal grandfather?
He would be 100.
100. And then what about your maternal grandmother?
97.
And paternal grandmother?
99.
99. Now, is your paternal grandfather still living?
No, all of my grandparents are deceased.
Okay. And do you have any children?
I have one daughter and I have one son.
And what is the age of your daughter?
My daughter is 16.
And how old is your son?
My son is 10.
10. And do they have any health problems currently? Asthma or any type of allergic reactions, allergies?
Well, my son seems to be allergic to latex, and my daughter has asthma.
Does asthma in your family?
Asthma primarily runs in along my wife's side. So,
Okay.
yeah.
Now, did your mother or father have any health problems?
My mother had cancer, type of cancer. She had like colorectal cancer.
Okay. And what about your father?
My father, he had no underlying health conditions.
Okay. Okay, so now I'm going to get into some mental health questions.
Mm-hmm.
Do you currently feel depressed, or have you ever felt depressed?
No.
No?
Mm-mm.
Do you have any problems with eating or your appetite?
No.
Have you ever attempted suicide?
No.
Okay. Have you ever seriously thought about hurting yourself?
No.
Or hurting others?
Nope.
Do you have trouble sleeping at night?
Yes.
Yes. Have you ever been to a counselor?
Yes.
Okay, so these are some male questions. Do you usually get up to urinate during the middle of the night?
Yes.
How many times?
Once.
Do you feel pain or burning with urination?
No.
Any blood in your urine?
No.
Do you feel burning discharge from your penis?
No.
Has the force of your urination decreased?
No.
Have you had any kidney, bladder, or prostate infections in the last 12 months?
No.
Do you have any problems emptying your bladder completely?
No.
Any difficulty with erection or ejaculation?
Nope.
Any physical pain or swelling?
No.
No? Okay. And is there any other underlying conditions that you may have been diagnosed with?
No, I have no underlying health conditions that are known as of yet.
Okay. Okay, so the next section is going to talk about health habits and personal safety.
Okay.
Do you do any type of exercise?
I exercise
Daily? Okay. Would you say less than 4 times a week or more than 4 times a week?
in terms of exercise. I exercise
Yes.
more than 4 times a week. I exercise about 6 out of 7 days.
Are you currently dieting?
No.
How many meals do you have on an average day?
I eat 3 meals a day.
How would you rate your salt intake? High, medium, low?
Very high.
Very high. What about your fat intake? High, medium, or low?
Very high.
Very high. And do you drink any caffeine, coffee, tea, soda?
All of the above.
All the above. And how many cups would you say that you drink a day?
4.
4. Do you drink alcohol?
Yes.
Okay. And what type of alcohol do you drink?
Whiskey.
Whiskey. And how many drinks would you say that you have per week?
5.
Are you concerned about the amount of alcohol that you consume?
Nope.
No. Are you prone to binge drinking?
Yes.
Do you use tobacco?
No.
Do you smoke?
Nope.
No. Do you chew any type of tobacco?
No, I do not.
Do you currently use recreational street drugs?
No.
Have you ever given yourself street drugs with a needle?
No.
Are you sexually active?
No.
Do you currently live alone?
No.
Do you have frequent falls?
No.
Do you have any vision or hearing loss?
No.
Do you have an advance directive or a living will?
Yes.
Yes. Physical and mental abuse have become major public issues in this country. This often takes the form of verbally threatening behavior or actual physical or sexual abuse. Would you like to discuss this issue with your provider?
No, not today.
Okay. Okay. This section will talk about your personal health history. As a child, did you have measles, mumps, rubella, chickenpox, or polio?
As a child, I had pox when I was 7.
Okay. And do you remember being immunized for tetanus or hepatitis, influenza?
Yeah, I get my flu shot every year, so I have the most recent influenza vaccine. And then I am up to date on my tetanus. I just had my tetanus shot about 5 years ago. And hepatitis, about, let's say, six years ago, I had that done. And then, what other shots? MMR. That is also up to date. I've had that done probably around 5 years ago.
Okay.
No, I do not have a pneumonia shot because I'm 37, so I don't have that yet.
Okay. Have you ever had diabetes, cancer, heart murmur, COPD, kidney stones, hepatitis?
No,
None?
no underlying health conditions as of yet. I'm healthy for 7 years.
Okay. Any surgeries?
I had my tonsils removed when I was a child. I was probably about 6 or 7 years old.
Okay. Do you remember the year approximately?
Let's see here. So I am 37 now, and I was 6 or 7. So that would be 1953.
Okay. And were you hospitalized for that, or was it in and out?
It was in and out.
Okay. And any other hospitalizations?
No other hospitalizations.
And do you use any over-the-counter medicine, prescribed drugs, inhaler?
No.
And do you have any allergies to medication?
No known allergies. Just my daughter has that latex allergy.
And then you did mention that your the asthma comes from your wife's side of the family. Are you guys still currently married, or?
Yes, we are married.
Okay. Okay. Now, do you take any vitamins?
I take a daily men's vitamin.
Okay.
Just after I get done exercising, my daily workout routine in the morning.
That's good. You get it over with in the morning. That's great.
Yeah, that's right. We got a busy day ahead.
I think it's easier to work out in the morning than at night.
It can be. Yeah, depends on how busy the day.
Okay, so that is all the questions that I have for you today. Did you have any questions for me?
No, I don't have any current questions, but I will let you know.
Okay. Well, thank you so much.
Of course.
Okay,
Should I record?
it's recording. Okay, it's recording. Okay, so the guy, he appears to be in his Maybe mid to late 20s, maybe 26, 27.
I would agree.
His gender is male. His level of consciousness, he doesn't appear to be 100% alert.
Would you say that he maybe appeared lethargic
Yes.
or obtunded?
His skin color, he looks a little paler.
Okay.
His facial features. Does his face look like it's a little droopy?
Oh, it looks like it a little bit to me.
Okay.
I think that's a little bit maybe asymmetrical because of that penis.
Okay. His body structure. I mean, his stature seems to be okay.
He looks kind of tall.
Okay. Nutrition, he looks a little undernourished. Slightly undernourished. Would you say that at least his body frame looks symmetrical?
That looks about right to me.
His posture looks good. He's not hunching over or slumped back. And what would you say that his body build is?
Well, he's not really muscular, but he's not really, in terms of like a somatotype, he looks like more of like a, what is the correct word? Is it an ectomorph for somatotype? I'm just throwing around words here. It is basically a thin frame, and it's difficult to gain muscle mass as well as fat.
Mm-hmm.
People who belong to the somatotype are usually skinny, lean, and have a high metabolic rate.
Oh, okay.
I think that's more of a psych. That's a somatotype.
Does he appear to have any physical deformities?
What do you think?
No.
No, he looks all right. Just maybe undernourished, that's all.
And his mobility, his range of motion.
Well, when I came into the room and when we assessed him, it looked like he was able to move his joints freely, so he has full mobility in each joint.
Okay. His facial expression. He does look. He does look agitated.
Mm-hmm.
And what about his speech? His speech was slurred, wasn't it?
Mm-hmm.
And his dress does not appear to be appropriate for the weather.
Right. It is. It's been cold here, and it's been 30 degrees outside, and you should not be wearing, shorts and sneakers.
No shirt.
And for sure, and, in the snow, trying to get around in those sneakers.
And what about his personal hygiene? His shorts look like they have not been laundered in maybe a week.
Mm-hmm. Maybe lacking a little bit of hygiene. Might need some attention. I guess the appropriate terminology would be unkempt.
Unkempt.
Okay, does that pretty much sum it up for our male participant here?
Yes, it does.
Okay. Should I go ahead and talk about the female participant?
Sure.
Okay, let's go ahead and quickly talk about her.
Okay.
And she came in, and her name is Jane, and she appears to be, let's see here, late 20s, about 27 to 30. She's obviously a female. The level of consciousness. She is alert and oriented to person, place, time, and the situation. Her skin color her tone is even. Okay. Her facial features appear to be symmetric. Her body stature. She seems to be excessively short when she was standing up. She was, I want to say, probably only, 5'2", 5'3", so she was a little bit short for her comparison group.
Okay.
You agree with that?
I do.
Her nutrition state, she seems to be well within her normal limits. We did her height and her weight. She was within the upper to middle part of the normal spectrum for her nutrition, for her BMI. Her symmetry, it seems like body parts are equal bilaterally, okay? Her posture, she seems a little bit stressed. Her shoulders are a little bit moved forward, so her posture is, a little bit abnormal. And this goes along with her position. She's got her arms at her sides, but then again, she's a little bit stressed because her shoulders are shrugged forward. So that leads me to believe that there's a little bit of abnormal findings there. And her body build and somatotype, I would say, is probably normal, which would be I think a mesomorph somatotype. So body build is very very normal. For her arm span equals her height. She has no inherent physical deformities. Her gait, when she was walking in, she appeared to be stumbling a little bit, and she had a little bit of a shuffling movement with her left foot. And this goes along with her range of motion, that she has limited mobility in that left knee joint. I'm concerned with the patient's behavior. Her facial expression and her general affect seems to be on the abnormal spectrum. Her facial expression, she has more of like a flat expression, negative affect. She seemed very, very hostile, and she was crying before she came in the room. So that leads me to believe that there may be some underlying conditions or need to address some issue there. Speech, she's clear and understandable now, but before I came in the room, was not barely able to understand what she was saying. Dress, she was appropriate for the climate. Yes, she is wearing pants, but she has probably more of a professional role that requires her to wear pants, even though it is 90 degrees, and nobody really wants to wear pants, but sometimes you have to do that. And her personal hygiene is appropriate, and she seems to be somewhat taking good care of herself, minus the rough, abnormal findings that we found for her affect behavior. Is there anything else that I may have missed from that assessment that maybe you picked up on?
No, you covered everything.
Okay, sounds good.
Okay. Okay.
Okay.
It's recording.
Okay. Hi, Stacy. My name is Matt. Nice to meet you today.
Nice to meet you, Matt. How are you doing today?
Doing well, doing well. How are you doing today?
I'm doing okay.
All right, all right. So I've knocked on your door and I've performed the proper hand hygiene, and I've identified your date of birth. As you stated here, is January 1st, 1975, and that you have no current allergies. Is that correct?
That's correct.
Okay. I just have a general health history question here that I'm going to ask you some questions today. Is that okay?
I guess so, if you have to.
Okay, okay. I'm just curious to know, Stacy, what is your marital status?
Right now I am separated.
Okay. When was the date of your last physical exam?
10 years ago.
Okay, okay. How about let's talk a little bit about your personal health history here today, Stacy. Have you been vaccinated against tetanus, hepatitis, chickenpox, or your MMR?
Yes, all the above.
Okay, okay. And do you remember when you had those vaccinations completed?
I have no idea.
Okay, okay. Well, we can contact your last provider and get that information, so don't worry about that. Did you have any childhood illnesses? Did you have measles, mumps, rubella, chickenpox, rheumatic fever, or polio?
I did have polio.
Okay, okay. Do you remember how old you were when you had polio?
I think I was 7.
Okay, 7 years old. Now, Stacy, I want to ask you a little bit about your past medical history. Do you have or have you ever had any of the following conditions listed here in this form?
I had a stomach ulcer.
Okay.
I have high cholesterol.
Okay.
And asthma.
Okay. Okay. Now, out of your the conditions that you listed, are you currently controlling your high cholesterol through any medication?
No.
Okay. Is it primarily controlled through diet and exercise?
No.
Okay. How about your asthma? Do you carry an inhaler with you?
Since I haven't been to the doctor won't refill it. So.
Okay. Okay. Well,
I have one, but it's no good. So.
Okay. Well, we can get you assessed today after this questionnaire is done, and we can get you taken care of. Okay.
Okay.
Okay. How about? I'm just curious to know, Stacy. Can you tell me about any surgeries that you had in the past?
I had my gallbladder removed probably 18 years ago.
Okay, 18 years ago. Do you remember what hospital that was located at?
Holy Cross Hospital.
Okay, okay. Any other surgeries?
I had a hysterectomy probably 3 years ago.
Okay. Do you remember what hospital that was at?
I think that was at St. Mark's.
Okay, St. Mark's, got it. Have you been hospitalized for any other reason?
I was hospitalized for a small bout of depression in my early 20s.
Okay, do you remember the hospital that you were located at?
No.
Okay, that's okay. So you said you have no current, do you have any other prescribed drugs that you're taking right now?
No.
Okay. Is there a reason why you chose not to take high cholesterol medication or control with diet or exercise?
I don't like going to the doctor.
Okay, okay. So maybe that's something that we can discuss later about controlling your high cholesterol with proper medication or diet. We can talk about that later if you would like.
Okay.
Okay. Do you have any allergies to medications? You said no known allergies at the beginning. Is that true?
Yes, that's correct.
Okay. Stacey, I just want to ask you a little bit about your health habits and your personal safety.
Okay.
All questions contained in this questionnaire, they are optional and they will be kept strictly confidential, okay?
Okay.
Stacey, can you tell me a little bit about your exercise? Do you exercise a few times a week?
No exercise.
No exercise? How about your diet? Are you dieting?
No.
Okay. How about your salt?
It's high.
Okay. How about fat intake?
It's high.
Okay. How about caffeine?
I do not drink caffeine.
Okay. How about alcohol?
I do not drink alcohol.
Okay. Do you use tobacco?
I do not.
Okay. Do you currently use recreational drugs?
Occasionally I'll smoke a little bit of marijuana.
Okay. Have you ever given yourself drugs with a needle?
No.
No. You can't do marijuana with a needle. Okay. Are you sexually active?
Yes.
If yes, are you trying to score pregnancy?
Definitely not.
Okay.
Well, that would be a little hard without a uterus.
Yes. Very true. Any discomfort with intercourse?
No.
Would you like to speak with your provider about your risk of illness, given that HIV, such as AIDS, has become a major public health problem? Would you like to speak to me about the risk of this illness?
Sure, we can have a conversation about it.
Okay, we'll have a chat after our questionnaire is over, okay? Do you live alone?
No.
Okay. Do you have frequent falls?
Sometimes.
Okay. Is that primarily when you're under recreational drugs such as like marijuana that you mentioned?
Yes.
Okay.
And sometimes just being clumsy.
Okay. Do you have vision or hearing?
No.
Do you have an advanced directive or living will?
No.
Physical and or mental abuse have also become a major public health issue. Would you like to discuss this issue with me, your provider?
No.
Okay. Stacey, I just want to ask you really quickly about your family health history. Can you tell me a little bit about, so you're 45, so can you tell me a little bit about your father, your mother, what ages they are?
My mother is currently in her 70s, 72.
Okay.
And my father, I'm not sure about my father.
Okay. Any significant health problems that you know of?
My mom had a, no, none that I know of.
Okay. Let me know if you remember anything more than the doctor, okay? Okay. Do you have any siblings?
No siblings.
Okay. Do you know the age of your grandfather or your grandmother?
My grandmother would probably be 99.
Is that maternal or paternal?
Both of them.
Okay. Both mutual lymph is required.
And my grandfather, paternal, would be 92.
Okay. And
Go ahead.
Any significant health problems on either your grandfather or grandmother on the maternal or paternal?
None that I know of.
Okay. Do you have any children?
No children.
Okay. Just a few more questions, Stacey, okay? I'm going to ask you a little bit about your mental health. Do you feel depressed?
Sometimes.
Okay. Do you have problems with eating or appetite?
Sometimes.
Okay. Have you ever attempted suicide?
No.
Okay. Have you ever seriously thought about hurting yourself?
No.
Do you have trouble sleeping?
Yes.
Have you ever been to a counselor?
Yes.
Okay. So I have some more specific questions here. This is our last series of questions here, okay? We're almost done. Now, given that your current situation is with your removal of your uterus, right? When was the age of onset of menstruation?
11.
Okay. Your date of your last menstruation?
So my hysterectomy was 3 years ago, so it was probably April 15th, 2010.
Okay. And this was your frequency for your period was every how many days?
5 days.
Okay. Number of pregnancies?
I had 1 pregnancy.
Okay. Number of live births?
0.
Okay. Heavy periods, irregularities, spotting, pain, or discharge present?
I did have heavy periods.
Okay. Are you pregnant or breastfeeding?
No.
Okay. And you said you did have a hysterectomy, so I'm going to go ahead and put it yes. But have you ever had a DC or a cesarean?
No.
Okay. Any urinary tract, bladder, or kidney infections within the last year?
I did have a UTI about a year and a half ago.
Okay. I'll note that here. Any blood in your urine?
No.
Okay. Any problems with control of urination?
No.
Any hot flashes or sweating at night?
Yes.
Okay. Do you have menstrual tension, pain, bloating, irritability, or any symptoms time of your period? Probably wouldn't be appropriate to you because of your removal uterus. So we'll skip that question. Have you experienced any recent breast cancer?
Yes.
Okay. Date of last with app and gram.
I would probably say right before my hysterectomy.
Okay. So this concludes the questionnaire that I have here. We'll be right back and we'll go off your underlying health conditions and some of these notes that I have here for you. Okay, Stacey?
Okay, thank you so much, doctor.
Okay, thank you.
Okay.
Okay.
It's recording.
Okay. Hi, Stacey.